I'm Todd Didier, Communications Director at the Primary Care Collaborative. Every month, the PCC recognizes leaders from across the nation that are improving the nation's health by strengthening primary care. This month, we're thrilled to welcome Dr. Shawn Griffin. Dr. Shawn Griffin is the first physician to serve as president and CEO for URAC, a leading independent nonprofit accreditation organization based in Washington, D.C. Prior to his role at URAC, Dr. Griffin held leadership roles at Premier Inc., the Memorial Hermann Physicians Network, Heartland Health, and Baylor College of Medicine. Dr. Griffin spent the early part of his career as a family medicine physician in rural Iowa and Missouri, and is intimately familiar with the challenges faced by the primary care community. Dr. Griffin, welcome, and thank you for joining us.
Thank you very much. Looking forward to talking with you.
We are thrilled to have you here, and jumping right in, could you tell us, how did you become a primary care champion, and why are you passionate about strengthening high quality whole person primary care?
Well, Todd, it all goes back to going into medicine in the first place. I don't come from a family of physicians. I grew up in a small town in rural Iowa, and primary care was the care that we had. And so I said that I went into medical school with my dreams of being a family physician. I said I dreamed of being a county seat doctor, as we used to call it in rural Iowa. That's the doctor who covers the hospital and has some partners and practices medicine in a small town. And so I went to the University of Iowa, a fantastic school for primary care. I just saw their recent match results, and it's mainly primary care coming out of the University of Iowa. And then I went to a rural family medicine training program in Mason City, Iowa. And during that time, there were times where we'd cover emergency rooms, and I'd be the only doctor in the county for the weekend or for the holiday or something like that. And so rural family medicine is what I plan to do. I came out of practice. I came out of a residency and I went into practice in St. Joseph, Missouri. Me and a couple partners in a 5-person medical group, just taking care of everybody. And that's what I thought I was going to be doing. So, I believe in primary care. My world was primary care. I remember the small town doctors who took care of me when I was little. And I wanted to be one of those. And I have carried that with me. I mean, even here in my Washington, D.C. office where I sit, 8 blocks from the White House, I still have my stethoscope and my white coat hanging there over my shoulder, just to remind me that it's all about taking care of people. Even though now I don't have the stethoscope anymore, I'm using my pen and my voice to try and make a difference here in Washington, D.C.
That's fantastic. So, talking about your work here in DC, could you tell us a little bit about how URAC is working to improve quality care right now?
Well, URAC is a healthcare accreditor. The analogy that I often use is that we go in and we audit the quality within healthcare settings. And URAC has been around for almost 35 years now, and I've been leading the organization for 6 years. And when I came into URAC, I looked at the programs that we had. We had a lot of programs in things like pharmacy and utilization management, utilization review. But in my time here, I've expanded the programs that we offer to include things like telehealth, community health worker programs. We do things with clinically integrated networks, which I think are big for primary care physicians, and some things around value-based care. And so there's that aspect of the programs that we do and the organizations that we work with. We also, when I came into this role, we had some programs that I thought were great programs, but they were a little expensive for small organizations. And so I created some programs where we actually offer cheaper versions of our programs so that small town pharmacies or small town hospitals can afford to bring the same quality standards as the big boys into things like contracting and in delivering care. So we just continue to work with things. One of our new things right now is we're actually launching the first healthcare accreditation for artificial intelligence in healthcare. So we're trying to go out there and make sure that these technologies, these innovations are best for patients, best for providers, protect everybody while they're continuing to expand. And then there's just sort of the sharing the experiences of the organizations that we work with, both big and small, when it comes to speaking with legislators and regulators here in DC.
You touched on there a lot of the different challenges that primary care is facing, whether it's, you know, cost of building out the infrastructure they need, or administrative burdens, or other major challenges facing the primary care field today. What do you see as the most pressing challenges in primary care today, and how should we address those challenges?
Well, I think anytime that you look at primary care, you've got to talk about a couple different things. There's the prestige of primary care. Are people going into primary care? As I said, we just went through match day and you saw some of those results, and primary care continues to do okay, but we still have a mismatch as to where providers are versus where people are. And then there's just the continuing declining reimbursements. Primary care has always, I shouldn't say always, has repeatedly gotten the short end on some of the reimbursement challenges over the past 20 years. And I see colleagues that I used to practice with or people that I run into, and they talk about how hard it is to have a good primary care practice. And that means if you don't have good primary care, you don't have healthy communities. If you don't have healthy communities, you have more expensive costs and care being delivered in areas where it just costs more. Telehealth should help to expand primary care into a lot of parts of the country. But I'd say reimbursement and just sort of the prestige. We talk a lot about reimbursement here in Washington, D.C., as they're looking to save money in those things. And very often primary care isn't at the table when those discussions are happening.
So, picking up on that thread, especially around reimbursement, if you could emphasize one major message to policymakers in DC or in state houses for that matter, uh, what would it be? What do you think is the major thread that policymakers can pick up to really help make sure that people have access to the high quality primary care they deserve?
I think there's two things that I want to answer on this one is there's the message to the policymakers, and that is the value that primary care plays into their communities. I mean, whether it be rural Iowa or rural Missouri or some urban areas where there's primary care deserts, we need primary care if we want to help control costs. If you look at countries around the world, and we're always comparing ourselves to other countries, and they spend less on healthcare, they tend to spend more on primary care than we do as a percentage of that spend. So it's having primary care physicians and providers in communities, have them be accessible, have them be paid enough to keep the lights on, I think is one part of this. But the other part is that here in Washington, D.C., they honestly just don't hear enough from the communities that they represent. I talk a lot about things in healthcare around communities. And when I speak with hospital systems or when I speak with students about healthcare, I say, your voices need to come into Washington, D.C. And whether that be phone calls, whether that be visits to D.C., those sort of things, being legislatively active, both in your state house and in the U.S. Capitol, is incredibly important for you to stay on the radar screen. And I say a lot of people spend money on lobbyists here in Washington, D.C., but a constituent coming into the office in DC is 10 times more listened to than a lobbyist who's walking the halls every day. And being able to tell the story as to how primary care makes a difference in your community is incredibly important. And if you're not reminding them, they forget. The other thing is that some people in Washington, D.C., who say that they are experts in primary care and those sort of things aren't really experts. I've been on calls where somebody was talking about primary care and they said that they were a rural primary care expert. And I said, they said some things that just didn't make sense to me as somebody who's actually been out there in rural areas. And I said, now you say you understand rural, where exactly do you practice? And they said, I practice in rural New Jersey, southern New Jersey. And I said, I'm not sure that's the rural that we're talking about here. I said, what makes you think that's rural? And he said, well, we have horse farms down here. And I'm like, okay, let me put it this way. If you have to pick which Starbucks you're going to go to, you are not actually rural. As a matter of fact, if you have a Starbucks to go to, you're probably not even rural. But there's great primary care in the cities. There's great rural primary care. But we need to make it easier to be doing the right things for these communities.
I think that is an incredibly important message to emphasize. I also think that your point is well taken, especially as this administration and Congress really has decided to focus on chronic care as a major issue. Uh, that really is only achievable with the kind of long-lasting, strong relationships that occur in primary care, and that's even more important in rural communities, right? Where the only relationship that may exist between a patient and a clinician is in the primary care setting.
Yeah, I mean that the relationship is so incredibly important. I mean, when I was practicing, I knew my patients. And I used to say that I wouldn't let anybody get admitted to the hospital from the emergency room until I went and saw them. And that's because in the emergency room where you don't have that relationship, somebody comes in and they look sick, you put them in the hospital. But if they come into the emergency room and they look sick and I go see them and I go, they've looked this exact same sick for the past 2 years. There's nothing new about this. We can take care of it in my office. And I see them the next day and that sort of stuff. That helps to keep costs down. So being known, being familiar with your primary care provider is incredibly important to make sure that care is delivered in the right spots and that we don't ratchet people up the expense chain when it's not needed.
So, kind of winding us down here, we've talked a lot about some concrete things that we think policymakers should be doing now, that we think advocates should be doing now. But let's say you have a magic wand. You can wave it and you can change one thing about the American healthcare system overnight. What is it?
I've thought about this question a little bit, and I've had a couple answers that sort of go through my head. It's really tough to sort of come down to one thing. If I've got a magic wand, I'm going to use it a couple times. But I think understanding the savings that comes from good primary care when it comes to how we prioritize where we spend money is incredibly important. I think for the system as a whole, probably having community members be able to speak directly to policymakers about what's valuable to them would probably be the main thing that I would do. Because I think that understanding that primary care, keeps costs down. If you want people to go into primary care, you have to pay them enough to keep the lights on. There's a place for tertiary care. There's a place for incredibly specialized care. But if we don't have hospitals and we don't have providers in communities in America, that's not how we're supposed to function as a society.
I think that's well said. Well, thank you so much for joining us, Dr. Griffin, and we appreciate all the work you're doing, both on broader on quality, but also specifically to strengthen and advance primary care.
Well, I often tell people, I say, if you look at my name, it says Dr. Shawn Griffin, and then it's got FAAFP, a Fellow of the American Academy of Family Physicians, and I was incredibly proud when I earned that distinction. So I'm a huge fan of primary care. So thank you for letting me be a guest today.